Hi, I'm Lorraine and this is Dr. Joyce, and welcome to our conversation on supervising provisional psychologists within the disability sector.
Lorraine, you've been supervising in disabilities for a long time. What do you think are the things that stand out in terms of supervising in this disability field compared to other industries?
I think mostly that it's quite a complex field and, it can be a bit challenging because the work can be very diverse. You're not really knowing what sort of work you'll be doing from one day to the next. So it can be a little challenging like that. And I think with regard to how we manage the competencies, we need to be aware of how that complexity impacts on those.
Yeah, and I'm just thinking back to previously, before NDIS, it was very much focused on intellectual disabilities. And now we have psychosocial, we have physical and intellectual, and the scope is so much wider, right? So that heterogeneity is massive. And so when you're in your early career stage and you're just trying to learn foundational and general skills, and then you've got all this complexity, it can be really overwhelming sometimes.
It definitely can be, and I think that's what we spend a lot of time doing with our provisional psychologists, is helping them kind of navigate that and feeling sort of comfortable in those grey areas for a little while until they start to understand the situations a little better.
Yeah, and I think it's helping them see that, what is actually feasible and practical within the scope of your service. You have limited funding, you have limited time. What is the actual diagnosis that the person is getting NDIS funding for? And be able to hone into that and develop some really practical goals that are actually realistic and achievable.
Yeah, absolutely. I agree with that. That spends a lot of time with provisional psychologists just trying to maintain those boundaries and keeping an eye on what we can actually achieve and working with other disciplines and professionals in the sector, because there are so many. So learning about who they are, what they do, so that we're able to kind of work together, in a multidisciplinary way.
Absolutely, yeah. There's a lot more systemic work in disabilities, and I don't think it's taught very well formally. Being able to work across disciplines, work with other support systems, and that's really part and parcel to how we work effectively in disabilities. How you empower other agents of change, and looking at holistically what are the barriers to change. Because as a psychologist first starting out, you have often very high expectations of yourself and what you think your client can achieve. And in disability work, often it's not about treating a mental health condition per se. It's about trying to minimize the functional impact of the disability. And, often these are people with very long-standing psychosocial disabilities where they've already received, many bouts of psych treatment and maybe with minimal success. So it's about having perspective around that and being a bit more realistic about ways to promote more well-being first before looking at more ambitious goals, I think.
Yeah, I'd agree with that. So Joyce, in your experience working within this sector as a supervisor as well, what types of topics do you usually see popping up in supervision with your provisional psychologists?
Yeah, that's a good question, Lorraine. I think a lot of people, I mentioned before, coming from a formal training in psychology, often have quite limited experience in disabilities. And this came through in my PhD research as well. Often people maybe have like half a lecture, if they're lucky, maybe a short workshop. But the reality of working disabilities can be quite different, and a lot of what we learn is very much like mainstream therapeutic modalities and assessments, and being able to adjust that and adapt that for people with disabilities can be quite challenging. And there's no guidebooks on how to do that well. And because there's such heterogeneity in people's presentation, people have very varying levels of communication, varying levels of intellectual functioning, and also receptive understanding as well. And being able to adapt to that does require a bit of trial and error sometimes, and being able to, I think, monitor progress and look at outcomes. Again, you don't always have great tools for that, so you need to be able to measure efficacy in different ways. So that's something we discuss a bit in terms of how do you do talking therapy with someone with intellectual disability? How are ways that you can adapt it to make it as accessible as possible? What are the prerequisite requirements to be able to, for that person to be a good candidate for therapy as well?
Yeah, definitely. I think the considerations for what would be the most efficacious treatment model, but also working with broader systems around the person and understanding how that functions is quite a task when you're a brand new provisional psychologist in this sector.
Yeah, definitely. And although there's a lot more research happening in this field, it's still an emerging field. So what we define as evidence-based treatments or evidence-based practice isn't always that clear-cut in disabilities. So you need to be able to draw on parallel research and do what we call more practice-based evidence instead of evidence-based practice. So you're using your clinical practice to build the evidence, even though it might be anecdotal, even though it might be just a single case at this point. You're still being able to determine through your own work what is efficacious.
Yeah, for sure. And I think then relying back on supervision and being able to have open discussions about, the goals that have been set and how we're going about meeting those and giving often good examples of the work that you've already done previously is a really useful way of doing that as well.
Yeah, and I think there's a lot more kind of eclectic approaches we use in disabilities compared to what you learn at uni. You learn about CBT, this is how you do CBT in 10 sessions, or this is how ACT therapy works and how DBT works. And often in disabilities, we have to be a lot more flexible. And this can come through a really good case formulation to really identify, what are the key areas that will make the biggest impact. And then what treatment is going to be the most effective. And sometimes you draw on some motivational interviewing, you draw on aspects of CBT, but maybe not the whole program. Maybe you draw on a bit of DBT. And so being, fluent in these different modalities is really helpful, because then you can be more skilled in applying what's actually useful for that particular client.
Yeah, I think having a firm basis in the theory of it helps you with the practicality later. So we can deliver it in different modalities. So if we've got little ones, we can use a play therapy or art therapy if possible, those sorts of things with further training. So they're definitely helpful. And I think going into the work with a level of openness and curiosity about the work and not coming in feeling like you need to know everything, because you've got to learn a lot from your client and understand what their resources are and their strengths so that you can do the work.
Yeah. And one thing that comes up as well is, potential ethical dilemmas and concerns around confidentiality and around informed consent. Because, you're taught at uni, this client needs to give clear informed consent before you can proceed. And in disability work, often these referrals come through support coordinators. Sometimes the client has very little knowledge of what this is about. They haven't even formulated goals or understand why they need to be provided certain therapy. So there's a lot more groundwork needed and potentially some motivational interviewing to help the person see, this is a reason you're referred. Do you agree with this? Would it actually make an impact? And through those discussions, then you can get consent that way. It's not a black and white situation where first session, they don't consent, they don't know why they're here, and it's like, bye, see you later. Because, we work in a systems approach, and it's also about supporting the systems to make sure that, they're still receiving the support they need and maximizing their engagement in the community and all those things.
Yes, for sure.
So, Lorraine, what tips would you give other supervisors who are thinking of supervising in disabilities?
I think it's a lovely area to supervise in. I think it's really, you get to use a lot of creativity and it's good to see a workforce coming together in this space as well. But I think it's really important to be aware of where your expertise lies, because the area is so diverse. We obviously have our areas that we prefer and that we're more comfortable in. And so being aware of those spaces that you work best in and being aware of other colleagues that you can potentially refer for secondary supervision and the like. If there's a subject that's, coming up that you're not too comfortable with or too familiar with. So I think that's really important. And I think, we've discussed before, being aware of the funding model, what area you're working within. Medicare is different to NDIS. NDIS is different again to privately funded services or, so on. So just being very aware of those boundaries and where our work lies.
And I think your point about expertise is really important. I think it's also identifying what are those generalizable skills that you have, but also to encourage of your supervisee, because it is easy to get overwhelmed when there's multiple diagnoses, which is the norm, and being able to say, well, your assessment skills are still the same, your foundational counselling skills are still very much applicable, and, those interpersonal skills are there, your case formulation skills are still needed, your risk assessment skills are still needed. So it's learning to apply those generalist skills into more specific areas that needs a bit more help, but it's not discounting everything person's already built and learned.
Yeah, I think it's definitely that layering approach, using those skills that you have and just layering them, or using a different lens to look at the work that you're doing, and showing provisional psychologists how to do that, is a massive skill. I think it helps you become a more flexible professional too.